plan. Thank you so much, Amy. I started talking before I mentioned about the recording. Amy keeps us on the go. So it's being recorded, guys. But one of the things that we know as it relates to the strategic plan, big on it, is the executive director. And I'm pleased to say that the board has appointed a subcommittee, and the committee is looking at what it's going to take to implement or to hire an executive director. And we have several steps that we need to follow, but more to come on that. More to come on that. I just wanted to give you an update in terms of a brief update in terms of where we are. And at the end of this meeting, about 7, we do have a section for questions and answers, and we'll be happy to take any of your questions at that time. Let me see, did Zach join?
Yep, I am here.
Awesome, awesome. Okay, so what I'm gonna do is I'm gonna just share my screen really quickly so we can go through the agenda. All right, so on the agenda, I just completed the welcome. I hope you guys all feel welcomed. And the next thing we're gonna have is Zach is going to introduce our spotlight on the local food policy council. And we're so happy to have Shekinah Miller with us from the York County Food Policy Council. And then right after Shekinah finishes with her questions, then board member Kyle Player will talk about RFSI. And let me tell you, I'm not sure when she's going to jump into this, but y'all, you need to listen, because if you're in the food system, what Kyle's going to be presenting on is an opportunity to get a $100,000 grant for equipment as well as some other stuff. So I don't want to, mess up with her presentation, but all of our ears need to be on Kyle's presentation. And there is a very tight deadline, okay? There's a very tight deadline to what Kyle is going to have to say. And Kyle will speak immediately after Shekinah finishes. Then another board member, Paula, is going to introduce our guest speaker, and she is going to talk on the state health assessment and health improvement plan as it relates to food and nutrition. And I'll let them introduce her background. And then this is going to, after that, once we finish with question and answers from our keynote speaker, then we will address any questions that you have or any grants or anything that you would like to share with the council. So with that, I will turn it over to Zach to introduce our local food policy council spotlight of the month.
Thanks, Miko. Hi, everybody. I'm Zach Hernstadt. For those of you that don't know me, I work with Amy and my colleagues Carrie and Ashley at the USC SNAP Ed team. And the main work that I do is around food policy councils. And one of the really exciting parts of my job is that I get to provide training, technical assistance, and work with local food policy councils around the state of South Carolina. And the other thing that the SNAP Ed does is that we provide some funding to fund staff for those local food policy councils. And we are really fortunate. I really appreciate Shekinah taking the time today from the York County Food Policy Council to share a bit of information about the work that they're doing and what they've been up to. I think that this is just a great opportunity for everybody on the call just to kind of get a feel for some of the work that's going on around the state at a local level. So I'd encourage anybody that's interested in learning more about starting a food policy council in your area, if you feel like that's something that you'd be your community's interested in and ready for, to reach out to Ashley and I. And I'll put my email in the chat. And with that, I'm going to turn it over to Shekinah Miller.
Hello, everybody. So I'm trying to share my screen. Okay. All right. Awesome. So good afternoon, everybody. My name is Shekinah Miller, and I am a part of the York County Food Policy Council. Later on, you guys, I'll go through why we had to change our name or why we decided to change our name. But just politics here in York County. So the structure of the policy council is here. So Impact York County is the greater coalition of coalitions here in York County, and that group has 4 specific work groups: healthy eating, active living, behavioral health, injury, and the equity and data committee. The subcommittee for the HEAL group is the York County Advocacy Coalition. The reason it needs to be, it acts as a subgroup right now is so that we can specifically focus on advocacy in the work that we do. And moving forward. The journey, how did we get here? So Impact York County was started in 2016. 2019, the county IYC received the Duke Endowment's Healthy People, Healthy Carolinas grant. 2020, we had hosted our first listening session in March of 2020. And the very next week, everything was shut down due to COVID. But during that space with COVID, that's when us as a typically considered suburban county outside of Charlotte, our food system, everybody experienced the same thing. So we created the Healthy Eating Active Living group, and we talked through some of the things that we needed to focus on as a county as it relates to food systems and, just getting people the resources that they need to eat and still eat healthy here in the county. 2021, we started the York County Food Policy Council and also received the SNAP-Ed Food Policy Council grant. 2022, we did a York County data walk, and that's when we also worked on completing the Community Health Improvement Plan and our Community Food Assessment. Those 2 things going on at the same time really helped us as we coordinated and, not going back and forth and bothering neighborhoods and communities too much and not over surveying people. So it was, thankfully we were able to do those things at the same time. 2023, we were able to publish the, thanks to the SNAP-Ed, we were able to publish our community food assessment. And this is where we changed the name of the, from Food Policy Council, which internally we refer to it as the Food Policy Council, but externally to other people, we do call it the Food Advocacy Coalition. We were getting feedback that it sounded too much like government, or it was too. They wanted to still, have some kind of. We wanted to be connected. Advocacy wasn't as hard or to deal with or digest as policy. So that's why we changed the name. Some of the goals that we have for our the coalition in this year is to work with farmers markets and school-based initiatives. One of the goals is to work to see if we can work with our farmers markets here in York County, so Clover and Rock Hill, specifically to do SNAP and double bucks. Really think about being more inclusive and accessibility to communities that need the farmers markets. And we've been working on this for a while, is working with farm to school initiatives. There is a nonprofit in Chester County that is willing to work with our school districts, but we're trying to find the right fit. So we do have some allocated funding from HPHC to use to help get this started, but we're just trying to find the school district that can hold the Farm to School initiative. And the goal of it is to do for students to gain employable skills, sell the produce that is grown in the farm to the school, and involve students throughout the entire process. So that's the goal. We really want to work on that. We thought we had Rock Hill and Fort Mill on board, but the amount of land needed, I think, is a little bit of fearful for some of the school districts, but we're still going to work with them and see if we can get it done before, or at least during the start of the 2024-2025 school year. Some of the frameworks and models that we use are collective impact and results-based accountability. This is just to make sure that we're working in a space of getting the work done and measuring it. and including equity in the work that we do as a coalition and as the Food Policy Council. The big part. So with the community food assessment, again, these two things, the community health improvement plan and the community food assessment, did happen at the same time. So we were able to use a lot of our secondary data from the CHIP also into the community food assessment, and it allowed us to be a little bit more intentional in some of the things that we included in our community food assessment. Some of the data highlights. York County does have a higher income than the state of South Carolina, but as you can see, there's a large gap, about $30,000 between white households and Black households here in York County. And, similar to South Carolina, but, and the income's higher here is because about a third of the county works in Mecklenburg in North Carolina. In York County, we don't have any packing or processing organizations here, and we only about 3% of all agricultural sales here, and 19 farmers markets or roadside stands, 22 animal production, 20 crop production sites, and 26 lawn, farm, or garden sites here. This is a map of York County, but the darker blue sections here are around 30% of those census tracts receive SNAP benefits. And so if we look here, this right here, if you can see my pointer here, the mouse, this lower section here on the southeast side is Rock Hill. So southeast side of Rock Hill. And the darker spaces are areas and census tracts that a lot of nonprofits and government, city or county focus on because of the opportunity zone, but also we in that space in Rock Hill and in this rural spot with the 72,000, we're seeing some of those places between 28,000 or 35,000. So less than half of the average income in those areas as well. So those are the SNAP households receiving SNAP here in York County. With the community food assessment, that secondary data was cool, but we did a survey specific to looking at our food system and looking at the assets and deficits within our community. And one of the questions from the survey that we used was, which of the following statements best describe the food eaten in your household in the past 12 months? Most people responded they had enough food with the kind of food that they want, but then we had about a third of the respondents say that they had enough food, but not always what they wanted.
Hold on one sec, please. Can everybody please mute their lines? Okay, proceed. Sorry about that.
It's okay. There we go. Another part of the community food assessment, after the secondary data and after doing the survey, we went into the community and we did listening sessions. And so talking to the community, we conducted the food gatherings in Rock Hill and Fort Mill, historically excluded communities. So typically Black communities, lower income communities. And we went there multiple times in each community to have a conversation about food system and health, and just those determinants of health that the residents wanted to talk about. People that were there were informed and just really excited that we were there. In Fort Mill, we were able to provide $25 gift cards. Same thing, but we had them available in Rock Hill, but no one, they did not want to take them. And that's the thing of your community. They were available, but the Fort Mill participants received them, and the Rock Hill participants just told us to save them for another time, and we did for other things. So it was, you really get, and so it was the thing of I could see people's faces light up. You know, they thought we were playing about having the gift cards available and they didn't know how much was on them. I'm like, but you know, it's my standpoint, and I think a lot of us, you know, have that standpoint. If we get paid to be there, we should also pay people for their knowledge and their skills, and you know, the things that they offer to help us build these assessments and report back to the community. So we're working to continue to build these lasting relationships within these communities. We want to expand to the more rural western side of York County. So we're talking Clover, Hickory Grove, Smyrna. Out in that space, which is closer to Cherokee County and Gaffney, but still here in York County. So we want to expand these relationships and grow other ones throughout the county. Some of the highlights from those community sessions was people were just excited that we came in and discussed the issues in a, you know, respectful space. We hadn't made any decisions yet, that we were coming in to tell them. We were just getting feedback and seeing what we needed to do. Also interested in creating, so this was still a few food gathering, but you know, we let the conversation go where it was, go where the conversation led from those people in the room. So wanted more relationships with elected officials, community leaders, and law enforcement churches. I'm concerned about health issues such as diabetes, hypertension, behavioral health, and access to dental care, which was surprising for us. And I'm concerned with barriers to healthy living, such as safety in your neighborhood, lack of transportation, grocery stores, location, distrust of just systems in general. So people coming in and not, you know, reporting back, and low income affordability and the eroding of existing infrastructure. So like the neighborhood sidewalks, parks and trails not being kept up by government, or, you know, those who are responsible for keeping those spaces up. Livable wages and affordable housing. So in York County, you need about $24 an hour to afford a $1,300 one bedroom apartment, which is the average going rate here in York County is $1,300 for housing. So, you know, affordable housing is a big issue here. Future PSE for us is, you know, looking at the data and surveys, and it's just being more, having our community become more active in the decision-making process. We do plan on trying to align the community action board with the infrastructure within Impact York County and the Food Advocacy Coalition, working towards expanding around healthier food options in the county, educating communities on how to become better advocates, and researching and acquiring funding to support employees of partner organizations to do this work within those communities, and partnering with organizations to provide job readiness programs and you know, just financial literacy and all those things that are happening in those communities already, and researching interventions that safely align with some of the efforts that are already going on with the healthy eating, active living, and injury work groups, which helps with that safety space if you're outside, you know, just being more active in your community. Thank you. And this is my contact information. And if anybody wants anything that I share or any other things that we have, I can share it. I know that was fast.
Awesome. Great presentation. We have about 7 minutes for questions. Great job. I thank you so much for sharing your story and where you guys all ended up. My question is on your farm to school program. Are the students still in the farming?
So the way we set it up, so last year we thought we were on board. We thought we had Fort Mill, but it kind of fell through. But it was through one of the teachers, when the coordinators came to us, and it was for the students. And it was going to be specifically in Fort Mill for the special education class, and they were going to get stipends to work, you know, hourly, get paid, everything to do the program, and it was for the students. So the way it was set up, they and it's still right now, there has been a lot of donations of getting the engineers to draw up what it needs to look like. So we have everything. We have the foundation. We just need the last little piece, which is the land, to get the project going. So, but it is for the students, and something that they could. So the farm that's in Chester has a nonprofit, but they also have a for-profit side that a lot of students already work at. So they thought this would be a good space to just start it in the schools already. So hopefully we can get it
Sounds
started.
exciting.
So I have
Follow-up
a
question. Are you guys, I'm sorry. Real quick, follow-up question, I'll be quick. Are you working with Clemson at all? Clemson Extension?
No, but we probably should.
Yes, okay. If you need help getting in contact there, just let me know, all right? All right,
All right,
Dr.
thank you.
Prince?
And I had a quick question. I was going to ask, was there a horticulture program embedded in the school already? Would you clarify that we're talking about having a space and the students are working after school and weekends?
Yes, so we don't already have one embedded in any of the school districts, but at least 3, Rock Hill, York, and Fort Mill all have a school that does applied technology stuff. So you have the culinary piece and the nursing. So each of those spaces have another set of land that they're not using. And that's where we were trying to look to see if we could do the farm already at a space where students are already gaining work skills. And, you know, each of those spaces have a lot of land. So we're just trying to see if we can, how do we need to work with the school districts to better support them in starting this initiative throughout the, so if we get one started, we know the other 3 roll along.
I will
I would
say,
suggest that
okay, go ahead.
try to cooperate or ask questions with the school board and approach it from that point of view.
Yeah,
Whether-
piggybacking on that, Dr. Prince. Yeah, that's going to be a really, really hard program to do without an ag teacher or an ag, you know, a farmer that's on staff. And I'll tell you, it'd be like near impossible. You know, to have somebody's going to have to be the farmer. And so, yes, you can, I put my information, or my email in the chat, but you know, Clemson Extension Clemson oversees, the ag teachers. And so, you know, but you would need to have your superintendent and your school board on board with that.
And there may be a local master gardener that might be able to do something with that, if not a certified ag teacher.
Awesome. Let's see, we got 3 minutes. Any other questions?
Yes, I had a question.
Okay.
My name is Norville. I'm with DSS. I'm the Healthy Bucks coordinator. I saw that you said one of your SNAP goals was to get SNAP information out into the community and also help get double bucks out there. I was wondering if you meant Healthy Bucks or if you're trying to do help double bucks, which I think is in another state. Can you clarify that?
Healthy Bucks. And so I am in York County, and I messed up with that with North Carolina.
Okay.
I'm sorry, y'all.
That's all right. That's all right.
Yeah.
Just want to make sure if you need help with that, I'm the coordinator for that. So.
All right, thank you.
Awesome. Can you drop your contact, Mr. Gibson, in the comments, please?
Sure.
In the chat. Awesome. Great work. Thank you so much. Thank you so much. I thoroughly enjoyed it, and I appreciate hearing from you about the work that you've been doing in York County. I lived 10 years in Charlotte, so I was feeling it. All right. So next up, we have Kyle. And Kyle is also a board member of the Food Policy Council. And I'm going to let her give you more about her background. But remember, y'all, said, listen, when you see Kyle, think dollar signs. All right, Kyle.
Thanks, Miko. Yeah, as Miko said, my name's Kyle Player. I work at the South Carolina Department of Agriculture, and I run a program called ACRE, the Agribusiness Center for Research and Entrepreneurship. And I am part of the team that's doing the RFSI project. Hannah, our kind of lead on it, couldn't be on today, so I am going to talk y'all through it. So before I say anything, as Miko mentioned earlier, you know, this is just a great opportunity. The USDA never lets you buy equipment, and they never let you do construction. So this is a great opportunity that if y'all know anyone that would be interested in applying, or if you're interested in applying, I highly recommend taking the time to do it. And I'll talk a little bit about this. It is a much easier paperwork process than any other federal program I've ever been involved in. So hopefully that will be a help to you. So, okay, is my PowerPoint showing in presentation mode?
It sure is, looks great.
Okay. So, oh, sorry, I'm at the end. Let me go back to the beginning. So, this is called RFSI, Resilient Food Systems Infrastructure. And it's actually, it says grant, but it's technically a cooperative agreement, but we're calling what we give down to the producers, organizations, nonprofits, government entities, whoever may be applying, we're calling those grants. But it is a cooperative agreement. Last year, USDA decided to do a program where a producer, a nonprofit, a government organization, a tribal government, whatever it may be, lots of people qualify to do a program where they could purchase equipment specifically for middle of the supply chain. So no production, so no planting, no harvesting. It has to be post-harvest of getting that food eventually to the consumer. So keep that in mind. So it is not, you can't buy a tractor to plant or harvest. You can't build a greenhouse because that's where you're growing and harvesting. So just keep that in mind. It's specifically middle of the food supply chain, and it is food that is for human consumption. So no animal feed, dog food, cat food, nothing like that. It's for human consumption. It does exclude, because they've already done grants for this, meat, poultry, and wild caught seafood. So if you're farming oysters, which we have a lot of oyster farms in the state, that counts. But if you're going out and shrimping, or you're going out and catching fish and bringing them back to be processed and sold, unfortunately that does not count. So anything else, so dairy, eggs, especially crop, which is produce, honey counts. If you're doing grains that are, again, for human consumption, not animal consumption, all that counts. And what we're mainly looking at from doing listening sessions and things like that is aggregation, so the storing of the product, processing, transporting, wholesaling, distribution of the food, whatever it may be. Again, just always keep in mind post-harvest, what is happening post-harvest of your product. So as I mentioned, this is kind of the middle, or again, we did listening sessions where we came up, or the public came up with kind of the 4 focus areas, and one of them is miscellaneous. So as I go through this presentation and you're interested in submitting an application that maybe is not referenced in here, we do have a miscellaneous category. So it will fall under that. But again, I know I keep saying this, just remember middle of the supply chains. Okay, so I mentioned this a little bit, who can apply? This is another unusual thing. It's very rare for individual businesses, specifically individual farms, to be able to apply for grant funding, or whatever you want to call this, cooperative agreement. So this is an opportunity for that. So agriculture producers, processors, co-ops that's built up of a bunch of producers, processors, again, nonprofits, government entities, anything really kind of qualifies, again, except for you can't be a meat processor or a poultry processor. So schools, universities, hospitals. So really they're covering everybody, which is really nice to see. It's not just for farmers or not just for government entities, but it's for a lot of different groups. Okay, I mentioned this earlier. I got a little ahead of myself. So the priorities So obviously we want to increase the local producer's ability to, again, process, aggregate, and distribute. So let's say you're a farmer that's looking to apply and you need a refrigerated truck and you purchase a refrigerated truck. Well, your application is going to score better if you're helping multiple producers and not just yourself. So let's say there's a co-op of 10 farmers and they get one truck and it's helping transport product for all 10 farmers. The USDA specifically said, you know, if you're helping multiple farmers beyond just yourself, that you stand a better chance of getting funded. So again, processing is a huge issue in the state. I know a lot of it is meat processing. That's a big issue, but there are other processing that's also bottleneck and things like that. So expanding the capacity to be able to process more product. So maybe that processor, because of that, could buy from 10 more farmers that they weren't able to beforehand. So again, keep in mind that helping more than just one producer or more than just one organization will definitely help on your application. Okay, so the important stuff, the actual grants. So there's what's called the Simplified Equipment Grant, which is, it really follows the name. It's just 5 pages, pretty simple. Just need some kind of information on what you're looking to purchase equipment wise. You have to have quotes for that equipment. It can be used equipment. You just have to be able to show that that equipment is in good working condition. So, you know, maybe if someone's selling it to you, you can say, they could say, this was used for 1 year. All is still works well. We haven't had any issues, yada, yada, yada. You get a letter from them, something like that. So do keep that in mind if you're looking at used equipment. So it's a $10,000 minimum. So if you have a piece of equipment that's only $5,000, unfortunately that wouldn't qualify. You have to hit that $10,000 minimum. It can be multiple pieces of equipment. It doesn't have to just be one piece of equipment. And the maximum on equipment is 100,000. So minimum 10,000, maximum 100,000, no match or anything. So pretty straightforward. Like I said, it's about a 5-page application. Just kind of, again, some hints, be very specific on what that equipment would help you do, and how it will help. Again, if it's again, just helping yourself doesn't exclude you from getting it. So if it is just helping you, explain why that is. If you're helping multiple farmers, be sure to specify that you're doing that and how that will help those multiple farmers. Again, just some kind of examples. A refrigerator truck, that one's come up a ton. A standalone freezer, there is one thing, like if you want a freezer and you get it and you just plug it in yourself, that counts as equipment. If you get kind of maybe a larger freezer that you have to have an electrician come in and wire it and get it ready, that technically counts as infrastructure. So if you're installing it yourself, think of it as equipment. If you actually have to have someone come out and do that, and that costs money, then that counts as infrastructure. So keep that in mind. Mm-hmm. Another example might be a chopping machine. So you have collards and you want to get a machine that chops them instead of you doing that. And then again, that helps you add value to that product when you're selling it than just selling it whole. So, you know, it helps in multiple ways. So those are just a couple of examples of equipment, but kind of, oh, I think they just are accidentally unmuted. Hey y'all, if you're unmuted, please mute yourself. Okay, so that's the equipment. And again, it's about a 5-page application, which I'm going to tell you where to find all this at the end. Then we have what's called the infrastructure. Oh God, look at me. I've been had the wrong slide up the whole time. I apologize, y'all. So that's what I just talked about. Again, you got to have the quote, all that, how the equipment will help you, no match required, minimum 10,000, maximum 100,000. Again, it can be multiple pieces of equipment as long as the total stays 100,000 and under. So it doesn't have to just be one piece of equipment that's 50,000. You could get two $50,000 pieces of equipment and only need one application. Again, I apologize, y'all. So the infrastructure grant. So this is a minimum 100,000, maximum 2.4 million. Now, if you've seen some of the press releases and things like that, the maximum is technically 3 million, but because of the amount of money South Carolina got, which the USDA uses a formula to determine all the states' allocated funding, we only have 2.4 million in the equipment grants. So, excuse me, in the infrastructure grant. So keep that in mind. If you see somewhere else where it says 100,000 to 3 million, don't ask for 3 million. We don't have 3 million. Because we had to split it up between equipment, infrastructure, and then a state-led project. Okay, so again, same thing, expands capacity for aggregation, processing, manufacturing, storing, transporting, whatever it may be. This one does require a match. So if you are socially disadvantaged, which you see the list here, veteran, beginning farmers, small, disadvantaged, minority, women-owned, you only have to do a 25% match. Otherwise, you have to do a 50% match. So if you're asking for 100,000, if you're 50,000, it's $150,000 project, and you're covering 50,000 of it. Otherwise, you go down to the 25%. So keep that in mind. And at the end, I'm going to talk a little bit about folks out there to help you with this. So if match doesn't make sense, which I agree, it gets very confusing, especially because there's cash match and in-kind match. They both weigh the same. So for example, maybe your time that you're putting in counts as in-kind, and your payroll counts as cash. So there's different opportunities there, which is great because some of the in-kind stuff helps you be able to provide a match that you might not be able to cash-wise. This one, the application is a little longer, but still compared to any other federal stuff, pretty simple and straightforward. So again, you're showing who you're benefiting. So how many ag producers. You're not showing that you're benefiting the consumer. There is a little section to talk about who it's going to, but they're looking that you're benefiting producers, not consumers. So keep that in mind. Again, if you're doing construction, it can be a new facility, it can be an add-on, it can be an upgrade of your current one, anything like that. You do, again, just like the equipment, you have to have quotes. So if you have a contractor, they would submit a quote, and you would turn that in with your application. Within that application, there's also templates for the match letter. And again, I'm going to go into a little bit of that. I know I'm on time, so I'll be as quick as I can. Again, just some kind of examples: simplified equipment, canners, egg packing machines, anything. Again, just always remember middle of the supply chain. Here is our timeline. So most importantly, the simplified equipment grant is due February 9th. So not too much more time. Again, it's 5 pages. It's pretty straightforward, other than finding that quote. And you don't necessarily have to go to an equipment place and ask for a quote. You could find something online that you want and provide that as a quote. So don't think of it as, oh gosh, I'm not gonna have time to get the quote in time kind of thing. So keep that in mind. If there's a $15,000 freezer that you just can go and buy, and that's online, you can show us that, and that is just as good as getting it directly from the dealer's mouth. So that one's due February 9th, because again, it is a little bit of a shorter application. We have a review panel that will go through and score everything. Same for the infrastructure. So that one's not due till March 1st. So a little bit longer out, because it is a little bit more that goes into that application. Again, external review panel will review and score. They give those back to us. We then have to submit them to the USDA. So USDA has final say. So as you can see, their process starts May 25th. They have told us 60 days. Hopefully they will stick to that 60 days. So funding period, they have told us specifically, we had to put this in our application, July 25th. But I'm telling you that money would probably not be available. I would say probably not till later in August would be my guess, because once they give us the go-ahead, then we have to do our setup. We can't do that until we have the final approval from the USDA. So do keep that in mind. And you have all the way till May 24th, 2027. Within the application, it's going to ask you your timeline. Just go ahead and put that last date, because if you finish before that, great. If you put an earlier date and you need to go past that date, you have to submit to us, ask, and it has to be approved. So just keep that in mind. So you may as well put that latest date. If you finish before, great. If not, great. But if you put, say, May 2025 and it's May 2025 and you haven't finished, then you have to submit approval for an extension and all this stuff. So keep that in mind. Now, we are paying a few folks to help with technical assistance. So Jim Johnson is going to be helping people complete applications. Steve Richards is also going to be helping people complete applications. Jim Johnson's actually going to be coming to Columbia once a week for a few weeks. So if you're interested in that, I don't know if Jim may be on here or not. I'm going to put his email in the chat when I'm done here, along with Steve Richards, who's with Clemson Extension with their agribusiness team. So there's two folks that are very familiar with grants, very familiar with helping people fill out the applications that can help you. Unfortunately, we cannot help you. That would be a conflict of interest because we're all working on it and all that good stuff. But those two are out there to help you. And again, I think hopefully maybe at the equipment, you can fill it out, and then maybe it's just you submitting to them for edits and suggestions. Because again, luckily it is relatively easy compared to most federal things. So that kind of is how everything's working. Again, hopefully we'll have funding maybe by August of 2024. That's the hope. Late August would be, again, my guess. So, and then I just want to mention, Ashley is traveling for work. So she wanted me to mention Ashley and Keisha with CFSA and Hannah, who's heading up this program for us. We are having an event in Columbia at the Phillip Market Center. So out at the State Farmers Market, February 5th. Now, this is not for people looking to apply. This is for people that are working in food systems in the state, as we're looking to collect information on what's out there infrastructure wise, what you think needs to happen, change, improve, etc. Because with our state project, we're doing a big mapping project and we're trying to collect as much data as we can. And this is kind of our kickoff to that. So it's going to be about a year probably of meetings. Here's that information. As you can see, Hannah Arndt, who I mentioned is leading the program for us. There's her email. So if you are interested in coming to that, food's provided. It's free, but obviously please register because we need a head count for the caterer. And then lastly, here is Hannah. We have a separate email for our side just so we can keep it all in one place. So Hannah and Aaron Fitzpatrick's our grants coordinator, both monitor this. So if you have any questions specific to this, if you could email this instead of Hannah's direct email, that would be great. Okay, I think that covers it all, Miko. Sorry, I know I'm right at my time, so that's probably no time for questions. But again, here you can email questions here. Or if you want to ask them in the chat, I can respond there. I'm going to put Jim Johnson and Steve Richards' email contact in there. So again, if you're interested in getting help with applications, please. And for people that are organizations that aren't applying, if you know of people interested in applying, again, this is just a great opportunity. This never comes along where you can do equipment and construction. So we highly recommend applying if you can.
Absolutely. I don't know if y'all excited, but I'm totally excited and definitely will be at the February 5th event. Now we do have 15 minutes for questions at the end. I'm seeing that people are in the chat with some questions. So we're going to go ahead and borrow 5 minutes for Kyle right now, if that's okay. So if you have questions, I'm going to read what's in the chat for Kyle to answer. But if you can please raise your hand if you have questions and we'll get to you. Question, Kyle, is how many quotes are needed?
It's not something where you have to have multiple. You can just have one. If yourself, maybe you want to get multiple, so you can find the best price, but you do not have to turn in multiple with the application. We only need one quote for the equipment.
And another question
Or
is,
for the either one, infrastructure or equipment.
and this feeds into that, can both grants be applied for?
Yes, both can be applied for, but you can only receive one. So maybe you take your chance, you know, double your chances. If you apply for both, you get one. So you cannot get both, but you can apply for both, if that makes sense. So maybe your infrastructure grant scores better than your equipment and you get selected for the infrastructure, or vice versa. So you can apply for both, but only get funding on one.
Are SAM's UEI information required for these grants?
They are, and we have a video online. Oh yes, I'll put that in the chat also, where you can find the application, FAQs, videos going through the applications, video on how to get your UEI, so on and so forth. Jim Johnson and Steve Richards can also help with that, which again, when I'm done answering questions, I'll put their contact info in the grant. But yes, you do have to have that, and we do have instructions on how to get that. Now, obviously the equipment's due February 9th. You do not have to have it by February 9th. You have to have it by time we turn it into the USDA, May the 25th, I think is the date. So when you're filling it out, you can say, have applied, still waiting. So don't panic if you want to apply for equipment and you're not going to have your UEI by February 9th. But do go ahead and do it, because you will need it by May 25th. So if you turn it in, waiting on it, once you get that, you would send it to us, and then we would input that on your application.
Gotcha. And we have one person that had their hand up, Cynthia Ford. Are you still on? I saw your hand went back down.
Yes, that was gonna be one of my questions about the UEI, if it was gonna be held against the applicant if they didn't have it. And for other applicants who may be applying, can they apply as a sole proprietor?
Yes, you can apply as a sole proprietor.
Okay.
So you just still have to have your UEI. Oh, and excuse me, it does have to, if you're a sole proprietor, you still have to have a business name. So your business name has to be with that UEI. It can't just be a name. So if you're a sole proprietor, but you have a business name, when you go to register for your UEI, use that business name, not your own name.
Gotcha.
Okay, so you would have to register with the state first?
Let me find that out, because I know sole proprietors don't have to. I can shoot an email, and I'll probably have the answer before we get off, and can shoot that to you.
Yes, and one last question from Ome, and then if you can, Kyle, check inside of the chat, because there's a question out there that I didn't get a chance to get to you.
Okay.
Ome, you want to ask your question live?
Yeah, that's the question I had in the chat is, for the equipment only grant, the minimum's 10K, but does that have to be for one piece of equipment, or can the 10K be for two pieces of $5,000 equipment, for example?
Yeah, it can be for two pieces of $5,000.
Okay.
We actually are we've discovered some language from the USDA, and we're actually have emailed them and are waiting to hear. There was something about that a piece of equipment cannot be less than $5,000, but we already know, and we've already talked to people that some of their equipment's going to be less than that. So we're working on finding that out. We think there's documentation that can be provided that if something's under 5K, that it would be allowed. So let's say you have $50,000 of equipment and two of those pieces are $2,500. We're making sure that that is applicable, because other program, they've taken language from another program. This is a new program, and the language is it can't be under 5,000, which again is an issue. They're taking stuff from old and trying to fit it to this when this is brand new and never been done. So we're working on finding out that answer, and should know before the end of the week.
Thanks.
Awesome. And then
Thanks,
when we
Amy.
get that, we do still have like maybe 5 minutes left for questions at the end. So if you guys can hold any more questions for Kyle, to the end, Kyle, you'll be able to stick around, right?
Yeah. And y'all, again, just if y'all have any questions, you can shoot it to that RFSI email if we don't get to them today at all.
I will say right quick, Miko, that on the UEI, you know, it's kind of hard. You still need to have a business that is acting as a business, because the documents that it asks you to provide to prove that you are what you say you are would be a bank statement or articles of incorporation or bills with the name of your business on it. So yeah, just saying that.
Food for thought. All righty. So thank you so much, Kyle. What'd I tell you? Did she live up to what I tried to tell you guys? Thank you so much, Kyle.
Thanks,
All
Mika.
right. So without further ado, we've come to the highlight of our meeting here today, and I'm going to turn it over to Paula. Paula?
Yes, hi. Thank you so much. It's great to see so many familiar names and faces, and it is my pleasure, if you haven't already met her, to introduce you to Dr. Cobra Ectaderi, and she is the State Health Improvement Director at DHEC. I met her back in 2018, and it's been such a wonderful connection because she is driving the bus, the train, whatever you want to call it, of population health, data analytics, informatics. If you've been to data walks, you probably have seen her. And it's very important that we tie in what the pulse of South Carolina's health is with food, the food ecosystem. So Cobra, Dr. Ectaderi, thank you so much. Welcome. Floor is yours.
Good afternoon, everyone, and thank you, Paula, for inviting me, and thank you, Miko, for working with me on joining all of you. This is really exciting, and I have to say my presentation is not going to be as good as the first one that you guys did, and I'm definitely not going to be as popular as Kyle giving out money. So that was really exciting. I was getting excited and wanting to go buy some equipment so we can help our communities. This is really exciting work that you all are doing, and I'm really excited to be part of this. So I just first of all, let me make sure I'm getting the right information shared, which I'm assuming you can see my screen.
Yes, we can. Looks great.
Awesome. Thank you. Some of you have been involved with our processes at the state level, and your community, representing your communities or your coalition and organizations in the development of the state health assessment and the state health improvement plan. So I just want to basically talk to you a bit about that and give you some information, hopefully, that you haven't heard, and how you can be involved and how this is connected to the work that you do. So we are doing the state health assessment and the state health improvement plan as a part of the strategic plan for the state, and as a part of the accreditation process. We started this process in 2017 and got accredited in 2021 in the middle of all that that was going on for managing COVID. And this is our second iteration. We are developing, we have completed the development of state health assessment, and I'll talk about that a little bit. We used the MAP process for that, and also took a life course approach. And again, I'll go into that a little bit. The state health improvement plan, we just started with that in October, and using the population health framework and RBA methodology. All of that is really being done on its own. It may not, it's still meaningful, but it's really not meaningful unless it is used as a part of the state kind of collaborative strategic initiatives and at your community level and at the programs that we work on. That's the only way that we can make a difference and kind of work together toward the same goals. Our state health assessment, we use a multi-layer organizational model. You're doing the same thing with the SHIP, just making sure that there is a diverse and inclusive representation of various partners, both internally within DHEC at our central office and our regional offices, and also our community partners. And then we have the executive committee, we have planning committee, and kind of putting all those experts together and to provide their input to make sure that we capture the inputs and develop a kind of the document that draws a picture of South Carolina population health. And that's what the SHAW is. And it is published right now on the website, on DHEC's website and the Alliance webpage. And I would really encourage you to look at the data and it is huge. It's 400 some pages of information with 300, more than 300 graphs and charts and I think 115 sources of data. So it's really comprehensive, even though it is not everything about population health data, but it is very comprehensive using the sources of data that are available to us at the state and national level and also county level. We developed a full report, which is that 430 pages. And then we also from that extracted a companion report that you can use. It's kind of a little more user-friendly, where you can print it and take it to various meetings and use it as a talking point and kind of share it with your community and partners. This is just a highlight of the table of content, just to show that how comprehensive it is, aside from, of course, the regular introduction methodology. And we added community voices this time, capturing the interviews and focus groups and listening sessions that we have throughout the state with our partners, and capturing that kind of community concerns, looking at forces of change that is in addition to the analytic data that we are doing. And that's a really rich representation of our community. And we also added a health equity chapter, because we want to focus, kind of bring our attention, even though everybody's focusing on health equity, and but we wanted to bring it to kind of front and center and say, without naming it, without really bringing attention to it as its own topic, it is difficult to address it head on. And then, of course, the healthy community. And then we went into a life course approach, looking at healthy mother, healthy babies, and healthy children and adolescents, healthy adults, healthy aging. And at the end, we ended it with a capacity to address health issues. So during those chapters, you continue seeing some of the issues, some of the big health concerns that our population in South Carolina faces. We wanted to end it with a positive note, in that aside from everything that's going on that we still need to work on as a community, we are doing so much work. So much work is already being done, just as you have heard earlier today. Exciting work is being done, impactful work is being done. We wanted to capture some of that and highlight some of that. So that's kind of a highlight about the SHAW, or the State Health Assessment. With the State Health Improvement Plan, we had our initial or kickoff meeting in October. Our main partner in doing this work is the Alliance for Healthier South Carolina. And many of you may already be partners with that organization. And if you're not members, I would really encourage you to look into it, to become member, or at least attend some of the meeting to learn more. But in addition to the Alliance, we're also inviting other community partners, coalitions to the SHIP process. So during that meeting, we had 60 organizations represented, and there was discussions and really a lot of wonderful, exciting interaction. And from all of that, we asked the participants to vote on topics using the population health model and trying to follow the result-based accountability methodology. And these are the priorities that were selected or voted on. Health equity, as you can see, was voted as our highest priority when it comes to quality of life. We can't really have public health without addressing health equity, or population health, or quality of life without addressing health equity. And then behavioral mental health was a big topic because of everything that was brought into surface, especially after COVID, with issues of drug overdose and suicide rates going up, and also the issues of isolation and some other mental health issues and behavioral health issues. And for length of life, I think all of you are familiar with the reports that went out last year on maternal and infant mortality and the disparity that is really highlighted in those reports. So overall, infant and maternal health is a big issue in South Carolina, big interest. And then specifically when it comes to length of life, that mortality and the disparity between kind of the number of infants and maternal death that affects the Black population compared to the rest of the population in South Carolina. On health behavior, this is where you're directly involved in, and we're really excited that these topics were selected or voted on during that meeting: access to affordable and nutritious food, and access to safe and affordable place to be physically active. These are really important topics and results that we want to get to in a collaboration and partnership with all of you. And it really impacts a lot of different priorities on this list as well. And we'll talk about some of these, how to get involved in a bit. And clinical care, access to high quality care for socioeconomic factors, education and income and poverty, and physical environment, neighborhoods and community development were selected. So as you can see that there is a lot of interconnection, there is a lot of kind of connection between all of these. So as you work on one issue, you can really impact the other part of the plan. So that is, we were hoping for that, and we kind of assumed that it would happen, but for it to actually happen, it was really exciting that we were all on the same page, that as a community, as kind of South Carolinian, we are thinking the same way. We really, our issues, our concerns are similar, and we want to work on the same things together as a community. And of course, when it comes to any kind of health factors impact on the population, it really starts, the bottom line is affecting policies, program, and practices. And that's where we come in together as a community. How do we, the work we do, the practices impacts our programs, and then all of that, how do we impact the policies within the state? So we then invited the kind of send invitation to various groups to become part of work groups that work on those priorities, because our work just getting started. We will have 2 co-leads for one internal from DHEC, because DHEC is leading this process, and external leads as well. And right now we have 90 people who have signed up to be part of the work group. So we're really excited. Each work group, kind of priority work groups, is going to work differently because of different partners are at different level of kind of developing strategies and using RBA and using these methodologies in coming up with their action plans and coming up with their indicators and all of that. For example, Healthy Palmetto, that a lot of you are familiar with, maybe member of, is one of our partners in addressing the health behavior priorities, both nutrition and physical activity. They have been really working hard the last couple of years, developing their kind of getting partners together, doing their partner mapping, involving partners throughout the state together, and also kind of at this point are from at the point where they are ready. They have their strategic kind of mission and vision developed, and they're ready to work on their strategic plan. So we are coming in that stage with them, and we are totally aligning the work we do with them. We don't want to create parallel organizations or parallel processes. We want this process to be as collaborative as possible and really as seamless into getting expertise and involvement from our various community partners. Again, these are kind of high level. I don't want to get into the detail of any of this, but as you can see, these are some of the work that the work groups that will be doing first coming up. So now that we have our priorities, coming up with our results statements and reviewing and refining those results statements using that RBA methodology, and then selecting the indicators, looking at the story behind the curve, and partner mapping. That's again where you come in, making sure that you are part of that partner mapping. What you do is known to the various work groups, and kind of making sure that you are at the table, decision-making table. Your input is really important. The great work that you're doing, make sure it's captured within that plan, because this is going to be our states. The whole state's not a DHEC plan. It's not an alliance plan. It's a state plan. So we want everybody to be represented. We want all of you to see yourself in that plan and say, hey, that's what we do. And this is how we are impacting the kind of that moving that ship forward. And then, of course, looking at our strategies and performance and accountability measures, and finalizing the action plan. The whole process of developing the ship is going to be kind of a, within a year. However, the work will continue. So again, just kind of to wrap it up, and I haven't checked my time, so I'm hoping I'm not. But we're finalizing our co-leads for the various work groups. We're hoping to have our work group kickoff meetings within the next couple of weeks or early February. And then our processes, we are really wanting a close alignment with alliances, Duke Endowment and Clear Impact project, which really follows that RBA methodology, and again involves you making sure that you enter your scorecard and the great work that you are doing for each of the priorities at in that system. So having access to the system, entering the information. We are also developing a dashboard that follows the SHA data, and that also gives you a lot of information. So you will have access, once that dashboard is developed, you will have access to data at your kind of county level and community level. So overall, we want us as a state to look at SCHIP as a roadmap for the future, for the next 5 years, and creating those ongoing and strengthening those partnerships. So 3 kind of topics keep coming up, and one is engagement. Make sure you're at the decision-making table. You make sure that your voice is being heard and counted, and then also that alignment, not creating new organization, not creating new work groups and new processes, but really aligning what this SCHIP is going to be doing with what is being done already, and what is being done, aligning that with the SCHIP. So it's really important to have that alignment, and then that really kind of establishing that continued partnership, and looking at somebody brought it up today, kind of rowing toward the same direction. That's the only way we can actually make a difference. As the Shaw shows in the capacity chapter, there's a lot of great work is being done throughout the state, and you see it in your meetings when you have it, and we heard it today, right? I mean, a lot of interesting, wonderful work. We're all committed to be in this business. We have to be committed. We have to be passionate in the work that we do. And you can hear it in, when we talk about the work that we do. But it's really important that we bring it together, work together as a community, as a state. So that's what we are, we're hoping, those kind of 3 direction that we want to take with engagement and alignment, and also increasing that close partnership within the state's programs and coalitions and communities and community centers and faith-based organizations, and all of us together. That's all I have to cover. And if there's any questions, please, if I can, I would, if you have time, I can talk about it. If not, contact me, and we'll make sure that we will include you, either at advisory level, or make sure that you come to the Alliance meeting, or making sure that we come to you and present to you with the updates that what we're doing. So again, thank you so much, Miko and Paula, for inviting.
Thank you so much for that presentation. I know we have questions, and I have a few to get us started. So if you have a question, if you could please raise your hand, and then we will get to you, or you can also put it in the chat. So my first question is over 400 pages. That is indeed comprehensive. That's fabulous. And I wanted to make sure I understand. In that 400 pages, is the assessment available by county, or is that something that's going to be worked on for it to be available by county?
Thank you. Great question. So again, I really, really, really encourage you to go to the website and look at the DHEC and the Alliance for Healthier South Carolina website. The report is absolutely impressive, and give us your positive feedback, because we all need it, because we worked really hard on it for the last couple of years. So your input, we did it for all of you. And so it depends on the data. So each indicator is looked at from various kind of breakdown, race, ethnicity, education, sex, and location. And where data is available, basically we look at the state data, compare it with the national data, and where it is available at the county level as well. Some of the data, of course, if the numbers are too small, we can't look at it from that kind of disaggregated view, but where we can, we do. And you'll see the map. Actually, those maps are really helpful to you. You'll see the maps where we actually show what counties, you can see where you fit in, even not only for your own county, but where you fit in within the state for a certain indicator.
Love it, love it. And I love the whole aligning the ship thing. I don't know if that's what you guys intended to do, but I'm loving it. I can see it. So Joey Curran, did you want to come off mute to ask your question? If not, I can read it.
I can ask it, no problem.
Perfect, thank you.
Just my question is how it is intended for this state health assessment process to align with what the local community health needs assessments are happening, and the same with that SHIP and our local CHIPs. What do you see as the alignment there, or is there a desire for them to be one and the same, or is it still the recommendation that local groups continue to do their own assessments and health improvement plans?
Great question. That's exactly where we want to go. We want to go where the SHIP at the state level is kind of really the SHIP, right? It kind of gives us the direction. These are the priorities. Now tell us at the community level, what are you doing to kind of make sure that we're going on those items specifically that kind of fits us. So it's basically kind of like a bigger umbrella, and then where you fit in. And it could be that in your community or based on your counties, your need and the data, everything that we're doing is science-based and driven by data. So it depends on where you fit in, you know. So for your community, be that obesity or diabetes is a big deal. For another community, it could be housing, as we heard today. It could be parks, not having community parks or neighborhood parks. So, or multiple of those, right? So we want to make sure that you choose the priorities that reflects your community's needs based on the data. And I know Paula, when she asked me to do this, she talked about data walks. So that's another thing I didn't mention. Our data walks are really rich, and we try to utilize the data for that community that is basically asking us to go there, depending again on data availability. And so that also, and we help you with that community health assessment. So we're saying basically we can come to you and say, here's the state health, basically SHIP assess or improvement plan. Here's your data, and then help you through that conversation and do facilitate the discussion to make sure that you come up with your priorities. So that's ongoing. We've been doing that since the last SHIP, since 2019. And of course, we had to stop because of COVID for a couple of years. And we started back up again in 2022. So just reach out to me, and I don't have my project manager here with me, but I can give Miko both of our contact information for you to contact us, and we can organize those data walks for you. And that's a good resource for you as well, in addition to the SHAW. So we're encouraging you to use the SHAW when you do your community health plan, but also use the SHIP. So that is also where the Duke Endowment Clear Impact Project comes in. So we are developing that so you can, at the community level, as you're developing your plan, you can put your plan in and keep track of it, and be able to kind of continuously track your progress and change. Basically, let's say you picked an action item and an action plan, and you really did great. Maybe that's all you want to do in that. Maybe you want to add something, or you want to change something, and there's an area that you're coming with roadblocks, and those roadblocks are not short-term. They're stopping you from moving forward. So there's a lot of flexibility in changing those action plans and measures. So we want to see, basically, if anything is going on in the state, we want you to be involved in that process. So once we develop, right now we have not developed the system, but that system development is in conjunction and with the SHIP development. And once we're done with all of that I'm hoping all of you in the various community will get access to it, and we'll have training, and a lot of you may have already had training with RBA. There's ongoing training, and I would really encourage you to take it. So yeah, I'm sure I answered your question, and maybe a little more than you asked.
Great, thank you so much. Very, very comprehensive in how you're asking your questions. Courtney put something in the chat about RBA training for those who haven't already participated. And last question, you talked about partner mapping. I just wanted to be clear, for those that are on this call, how do they get involved? Should they email you and your project manager, or is there another way to get involved in the partner mapping?
At this point, I would say, because we closed the sign up for the work groups, so it would be great if you can contact us, and then either we'll put you, depending on your interest, put you in the right work group, or at least make sure that we have your contact information so we can give you updates or get the information from your organization. Let's see, in the work that we do, if you're working on improving housing in your area, or in the information that was provided to us about agriculture kind of development and growth. If you're doing something, we want to make sure that we capture that. So that those kind of things. So at this point, I would say just email me and Farron, and we make sure that we will include you.
Thank you so much. Thank you so much for your time and amazing presentation. We really appreciate you. So we have about 5 minutes left for just general updates. So if anybody has any updates that they would like to share, any meetings that are coming up, Courtney already dropped something in the chat. If you want to drop anything that you have going on in the chat, that would be great. Or if you want to raise your hand, come off mute and address everybody. Now is your opportunity. And or any questions for any of our speakers. They're all still on.
Sorry guys, I'm trying to close my sharing, but it seems like I don't know how to do that. So if you're looking at this still.
No worries. Okay, I see Weatherly has her hand up. Weatherly?
Hey, if anyone's interested in serving on the communications committee for the South Carolina Food Policy Council, we've got some pretty big things we need to do. We scheduled a meeting for Wednesday, the 31st at 9 a.m. So 9 a.m. to 10. And if you, again, just would like to email me, I will email you that Zoom link. I'm putting my email in the chat again. So if anybody's interested in serving on that committee, the communications committee, we're meeting January 31st at 9 a.m. Thank you.
Anyone else? All right, so our next meeting will be Tuesday, April 9th from 1 o'clock to 2:30. And man, this meeting was jam-packed. What do you think, guys?
Great information. Thanks, Mika.
Awesome. Hopefully it was a good use of all of your time. Happy New Year and all that jazz. In this state, we're off to a great start. And I'll see you all soon. Thank you so much for attending.
Thanks, Mika.
Bye, everyone.
Thank you.